medical coding family, let's review the guidelines for consultation. EM Coding, the CPT Codebook, provides guidelines in reporting, office, and inpatient consultation codes. Consultation EM services require 3 basic components, which are commonly abbreviated as request, render, and report. Request is when an MD requests another MD to see their patient for a specific problem, not the total or take over care of their patient. The request can be written or verbal with documentation and medical records. Render is when the consulting MD evaluates the patient and either recommends care for the patient's condition. A report is when the consulting MD submits a written report back to the requesting MD stating their recommendation for the plan of care on their referred patient. Please refer to the CPT Codebook for a full detailed view of the consultation guidelines. The guidelines are not in only one location. Check out these guidelines in Inpatient section, along with looking under the Consultation section, CPT consultation codes when consultations are performed for Medicare patients. Outpatient consultation services are reported with office or outpatient EM codes. Inpatient consultation services are reported with initial hospital codes. Other non-Medicare payers may continue to use CPT consultation codes. Always check with individual payers for policy guidelines. If the patient is covered by Medicare, the information is provided in the case note or the question to know which consultation guideline to use. The table lists the E&M codes to use when reporting a consultation for a Medicare patient. What is a referral? Consultation services differ from referrals. A referral occurs when a patient is sent to another physician for care of a specific problem or condition. The requesting physician is not expecting to receive recommendations back from the referring physician and does not continue treating the patient for that specific condition. The referring physician will be taking over the care of the patient for that specific condition and will not report the consultation EM codes, but another appropriate E&M visit code. This is where a lot of confusion happens during medical coding exams. A referral is not a consultation. See this example for consultation and referral. Referral and transfer of care are synonymous terms indicating that a part or complete care of the patient has been delegated to another physician for the referral. Take the time to read these examples on this slide for yourself. Pause the video if you need more time. The cardiologist is not providing consultation, but taking care of the patient's specific problem, which is the heart murmur. When transfer of care has been established after the initial inpatient admit, the provider accepting care reports the subsequent hospital care visits. Okay, it is your turn. Let's practice this certification exam question together. A 52-year-old male was admitted to the hospital yesterday for pneumonia and chest pain. Lab results showed elevated troponin levels. Doctor, cardiologist was asked by the patient's admitting physician to see the patient later that day of admission for the chest pain. Dr. Cardiologist performs an appropriate history, exam, and moderate MDM. Dr. Cardiologist will treat the chest pain during the hospital stay. Based on CPT coding guidelines, what is the appropriate EM section for this encounter? Subsequent hospital care, initial hospital care, new patient office, outpatient services, inpatient consult. What do you think is the answer for this question? Let me know your answer in the comments below. Also, if you find this content helpful, please share, like, heart, and let me know in the comments down below what else I can create for you that you think will help. The patient is in the hospital. This eliminates the new patient office visit and eliminates the admit hospital visit. The consult requirements of request, render, report were not met, and the doctor cardiologist will be treating the chest pain during the patient's hospital stay, so that eliminates the inpatient consultation. Subsequent hospital care is the correct choice for this scenario, as the chest pain care is transferred to the cardiologist. Be sure to check out my website at medicalcodingbyjen.com for workshops, free resources, and join our free Discord study group there too. I hope this was helpful.